I mean, it depends on your age and it depends on your underlying risk factors. But to be honest with you, I wouldn't lose sleep over it. You know, it is here. The chances of anything really of you requiring hospitalization, if you are boosted, if you're double vaccinated and you receive the booster and you're not in a high risk demographic or an otherwise high risk group, chances are you're going to get this. We're all going to get this. And chances are you're going to have mild to minimal symptoms should you get this. So, so again, it's about managing that risk and keeping that risk in perspective and not being, you know, overwhelmed or crushed by it. I think for young people, the key is normalcy and a return to their lives, right? To their social lives, their environments, their activities. All of these things become extremely important. Keeping kids locked in, isolated from one another, isolated from schools and from teachers is having a profound impact on their mental health. And I really hope that there is a growing realization around this. And hopefully there will be financial resources as well put into place, particularly through our public school system, that will allow schools to be able to appropriately respond and help those kids who are in distress. We have seen increased eating disorders. We have seen increased suicide attempts. We have seen, you know, other forms of self-harm, particularly among adolescents. And so as parents, as teachers, as healthcare workers, we need to be on, you know, on the lookout for these kinds of things and make sure we're having the right kinds of conversations and providing kids with the support that they need. There's, you know, ultimately, and I say this because I've worked in war zones with young people who've experienced extreme violence and atrocity and abuse over many months, and who are, you know, extremely traumatized. And what helps the most is consistency, stability, and opportunity, right? It's that sense that their lives are able to, that they're able to move forward, that they can have hopes, they can have dreams, that they can pursue them, that they feel supported in pursuing them. And I think that that's true for kids here in the context of the pandemic as well. It's about being supportive, being understanding, and making sure that they are getting back together with their friends and not living in this state of constant fear and anxiety that they should never see anyone or do anything. You know, get them outside, even in January, get them outside, get them out tobogganing, get them doing things that make them happy, and get them hopefully soon back into their sports and their other recreational activities. Resiliency is hard. All I know from my own work and time I've spent overseas is that getting together with family and friends, even in the context of a pandemic, in smaller numbers, right, but in different ways, it brings huge psychological relief. We have to find the joy. There are some scientists who believe and who have called Omicron the live attenuated vaccine we've all been waiting for, in the sense that it's not as lethal, it's not as serious, it's highly transmissible. Most people are going to get it. It's going to give them a level of protection, not only against Omicron, but against other related variants for at least 6 months, which is extremely encouraging news. And so again, if it continues down this path, and there's no reason to believe that this virus will be an exception. I know we're so used to really terrible news here, but there's no reason to believe that Omicron will be, or that COVID will be the one virus that goes in the opposite direction from being, you know, extremely virulent to not as virulent to suddenly being extremely virulent again. It just, that trajectory just doesn't really happen in nature. And so there's every reason for us to believe that with time, it's going to be less and less and less significant. And so our reaction to it should be less and less and less, you know, heavy-handed, really, that we hopefully it'll just be one of those things that we, one of those risks that we learn to navigate and that we kind of tune out.